Learning why our bodies react a certain way can seem like a mystery and at times a bit scary. The St. Luke's rheumatologists and endocrinologists are dedicated experts willing to help us understand and battle inflammation and chronic disease. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at inflammation and chronic disease with experts from St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Rajesh Kuparaju. Dr. Kuparaju is a fellowship-trained rheumatologist who treats autoimmune diseases that affect every organ system in the body. And he evaluates bone and mineral content and density, determining factors for bone health. Dr. Kuparaju, thank you for being here.
Thank you for having me.
So tell us a little bit about what is rheumatology. It's a big word, it's a big field, and what drew you to that field of medicine?
It is definitely a big word, and it's definitely a very big field. So rheumatology is a study of specific autoimmune diseases, and in the case of rheumatology, things that tend to affect the muscles and the joints. Oftentimes, our diseases also can affect the entire body, such as in lupus, for example, which many people may be familiar with. And the reason that I decided to go into rheumatology is because I myself have a rheumatologic disease. I have what's called psoriatic arthritis, which is a condition where my immune system, which is supposed to protect me from infection, instead is attacking my joints and my skin. So having gone through that experience as a patient, that kind of helped me decide what I wanted to do and help other patients going through the same similar sorts of situations.
And when you see a patient for the first time, what is your general approach to them, especially if they're concerned but don't really have answers yet?
So that's probably the most typical patient we get, is patients who are concerned and have been to a lot of different doctors and have not yet found an answer. So the first thing that I want to do is reassure them that what they're feeling is real and that this is something that is actually going on. The fact that we don't know what it is yet doesn't mean that they're not suffering or in pain, because sometimes patients get worried that their pain is invalid. Just because someone cannot figure out what's going on doesn't mean it's not real.
Well, I think that's really important for patients to know that you're going to work really hard to get those answers maybe they haven't gotten yet. Great, thanks for being here. Joining our panel next is Dr. Ishita Singh, an endocrinology, diabetes, and metabolism specialist with expertise in treating diabetes, thyroid, and adrenal disorders, as well as obesity. She also treats many other chronic health conditions. Dr. Singh, thank you for being here.
Thank you for having me.
How did you become interested in endocrinology, and how does what you do differ from what Dr. Kuparaju does?
So my interest in endocrinology really started because of my personal experience with my grandmother. My paternal grandmother lived with us while I was growing up. She was diagnosed with diabetes. I saw the impact that it had on her health. And as a family, we made a lot of changes to help her manage it. And that really laid the foundation of what an important lifestyle can have on our general health and wellness. So that's how my initial interest in endocrinology started. But then I realized that it encompasses a lot more than just diabetes. Endocrinology it can be complex, can affect every organ of the body, and that's something that I find very fascinating. That's how my interest in the field came up and why I chose to pursue endocrinology as a profession.
Often people are confused as to what's the difference between rheumatology and endocrinology. Can you explain that to us?
The endocrine system I would want people to think of as mostly related to hormones. It's the hormone system of the body, which is very wide. And there are a lot of different organs that are involved. It includes the thyroid, the adrenal glands, the pancreas, the reproductive organs. So very different from an autoimmune condition. A lot of these conditions are chronic and can be associated with inflammation. So sometimes people come to us with very general symptoms, which may be overlapping with hormonal conditions as well as autoimmune conditions. But the big distinction is that one is autoimmune versus the other being more hormonally based, though some conditions may have an autoimmune basis as well.
Thank you both for sharing your expertise. We'll be right back after a short break. But before we do that, let's check in with Dr. Ike Akusuba out in the field as he discusses the link between obesity and inflammation.
I see patients on a daily basis, and we go over their medical conditions, and then we determine kind of what we feel is going to be best for them as far as surgery is concerned. And we also talk about medications also. That's my role for bariatric surgery. The difference between being overweight and obesity is essentially your BMI, or your body mass index. So a BMI of 25 to 29.9 is essentially being overweight, with a BMI of 30 to 34.9 with conditions, that's considered obesity. Obesity increases your risk of developing conditions that can negatively affect your health. And some of those conditions include diabetes, high blood pressure, obstructive sleep apnea, even osteoarthritis or any kind of inflammation in the body. Just a general feeling of unwellness can occur when you have excess weight because your body is essentially swimming with inflammatory markers. Weight loss can definitely improve conditions, and they can essentially reverse a lot of conditions too. It's very nice that we have a large array of medicines that work well in treating obesity, and they act on your body to help improve your insulin resistance, and they can help you feel full, and as a result you tend to eat less. So when you combine medications like this with healthy diet, lifestyle modifications, increase in exercise, then you can see a significant amount of weight loss occur. Bariatric surgery is very effective for patients who are looking to lose a large amount of weight and also maintain that weight loss. Also, patients who are looking to treat conditions like diabetes and high blood pressure, patients who are trying to look to decrease their medication burden, patients tend to do very well. They tend to leave the hospital the very next morning after surgery. Patients that have diabetes, they can leave the hospital with no medications. The surgery works that quickly, but what makes me happy is seeing patients after surgery, seeing them months later, years later, and oftentimes I can see patients crying, but they're crying because they're happy, because of all the conditions that have gone away. They're feeling better, they're healthier, they have more energy, just a better quality of life, and that's what truly motivates me to keep going.
You're determined to stay active and enjoy life. Be at your best every day with St. Luke's Orthopedic Care. Start here and we'll get you back to doing what you love. With locations throughout the region, including our new St. Luke's Orthopedic Hospital West End campus, the best place for orthopedic care is always close to home. St. Luke's Orthopedic Care. Start here, go farther.
It's here! For real! It's St. Luke's Children's Hospital, ready to help all kids. They're keeping kids healthy, fixing us up, making us feel better, helping kids be the best they can be, because it's about us. The kids! It's St. Luke's Children's Hospital!
St. Luke's Children's Hospital is helping kids with everything, from routine checkups to specialized care.
It's here! It's great! Yeah!
Welcome back to St. Luke's Health Now. Tonight we're discussing inflammation and chronic disease and the many advances offered at St. Luke's. We want to thank you, our viewers, for tuning into our program and submitting your personal questions to be answered later in the show. Joining me are rheumatology and endocrinology experts Dr. Kupparaju and Dr. Singh. Let's dive deeper into this topic at St. Luke's. Dr. Kupparaju, I want to start with you. We've talked a little bit about autoimmune, but what is an autoimmune disease and what can it affect in your body?
The best way to think about the body's immune system is kind of the frontline soldiers fighting against infections and things that should not be in the body. So it's made up of a lot of different cells and proteins that kind of help protect your body from outside invaders. So in patients who are normally functioning, that system does its job, protects you from things like the cold, like strep throat, for example, and other types of infections. But in patients with autoimmune diseases, that system starts attacking its own body. So that's when their joints get inflamed, their organs can get inflamed, and it really depends on what part of the body that immune system is attacking. So that's kind of the difference between a normally functioning immune system and someone with an autoimmune disease.
It's a lot to differentiate and I think challenging often for patients to understand. And Dr. Singh, you were talking about the endocrine system, and the hormonal system has a lot to do with your endocrine system. Tell us what you look for when someone is describing their symptoms and how you might know there might be an issue with their endocrine system.
So that is a very wide topic and a very broad question. Because the endocrine system, it encompasses a lot of different organs which form different kinds of hormones. So for example, there's the thyroid, which makes thyroid hormone, which is mostly a metabolism hormone. Then you think of the pancreas, the predominant hormone that most people think about is insulin, which helps control normal blood sugar. And if someone's not making enough, they could be diagnosed with diabetes. If it's affecting the reproductive organs, there could be, for example, for women, a change in their menstrual cycles, difficulty in conceiving, infertility. So it really depends on what kind of symptoms someone comes with, which helps us tease out what organ may be impacted and thus really help us decide what we need to investigate further.
Yeah, so a very personalized approach to each individual symptom.
Absolutely.
Dr. Kuparaju, you mentioned rheumatoid arthritis, but what are some of the other most common conditions that fall into this category of autoimmune disease, and how are they diagnosed?
Some of the most common ones we see in rheumatology are, like you mentioned, rheumatoid arthritis. Lupus is a quite common one, psoriatic arthritis. Those are probably the three that I would say I see the most in my clinic, though there are some rarer ones, such as vasculitis, which is when the immune system starts attacking blood vessels.
When you're trying to determine what autoimmune issue someone might be challenged with, what are the types of symptoms you're hearing, and what are the context clues that gives you as to how to direct their care next?
So part of it is very similar to what Dr. Singh was talking about. A lot of it depends on what organ systems are involved, so what complaints the patient comes in with. So if a patient comes in, for example, and says, my joints are really stiff when I wake up in the mornings and they're very swollen, then I might be thinking about something like rheumatoid arthritis. If a patient comes in and says, I've been coughing up blood and I'm having trouble breathing, then I would worry more about an autoimmune disease attacking the lungs or the blood vessels in the lungs. And for each of these types of diseases, there are different blood tests that can suggest a specific condition. But for rheumatology in general, it's very rare for us to have a blood test that will 100% tell us what's going on. So it's a lot of talking to the patient, figuring out what their symptoms are, looking at their blood work, and contextualizing it with my perception of what's happening with them.
It's really important to look at the entire story and for patients to pay attention to their symptoms and really not discount them, I would imagine.
Absolutely.
Dr. Singh, what happens inside the body when someone's diagnosed with diabetes? You mentioned the pancreas and the role that plays in insulin, and how does that bring about inflammation?
So diabetes is a condition in which someone's blood sugars are higher than normal. And hyperglycemia does increase inflammation by producing what we call reactive oxygen species, or it's a little more technical word, but it's called AGEs, or advanced glycation products, which are pro-inflammation. And what that does is that it does put people at a higher risk for cardiovascular events, coagulation, which is increased clotting, atherosclerosis, which could be hardening of the blood vessels, heart attacks, as well as strokes.
Wow, so a lot of things to be looking for and paying attention to if you're diagnosed with prediabetes or diabetes. Dr. Kuparaju, what about rheumatological diseases? Can they be cured? And if not, are there treatment options that patients should, sort of be excited about that can really help them ease the symptoms?
So the first part of your question is a little bit tricky as to whether or not they can be cured. So the problem with rheumatologic diseases is that it's not something that the patient has done or that has been done to them to cause this. It's something that they're born with the predisposition to get. And so because it's almost part of their biological makeup, it's difficult to cure. However, we do have some recent studies that are currently still in trial for conditions like lupus, for example, that are investigating cures through things like bone marrow transplant, which is often used for cancer patients. So that's something exciting that hopefully within the next decade or so we might be able to really help cure some of these patients. As far as other advances in the field helping to alleviate the symptoms that these patients are seeing, we are a very fast-growing field, and there's constantly new medications being studied and new trials being done. I would say on average, as long as I've been in rheumatology, there's probably been at least 2 or 3 new drugs a year that I've been able to use for my patients.
Wow, 2 or 3 new drugs a year is pretty promising. Yeah. Dr. Singh, tell us about metabolic syndrome. What is it, and does it usually lead to diabetes?
So metabolic syndrome is a combination of certain conditions which do increase the risk of insulin resistance, cardiovascular disease, as well as diabetes. Most of the time, this is diagnosed if someone has 3 of the following 5 conditions. The first is high blood pressure. Second is high blood sugars. The third is abnormal cholesterol levels. And That's kind of twofold because there are two cholesterol levels that we're looking at. One is the triglyceride level if it's greater than 150, or if the HDL, which we think of as the good cholesterol, is less than a certain amount. So if it's less than 40 in men and less than 50 in women, it increases the risk. And the last is waist circumference. So if it's greater than 40 in men or greater than 35 in women, that does predispose them to those conditions.
So those are some good baseline things for people to pay attention to, where they might want to look at their lifestyle and ways they can maybe decrease those numbers. Dr. Kuparaju, what are you looking for in patients, and what are symptoms patients might have that are possibly red flags that they should say, you might need to get in to see a rheumatologist or an endocrinologist?
So for rheumatology, one of the main things that people will describe for rheumatologic conditions affecting their joints is a lot of joint stiffness in the mornings. And typically that'll last for about an hour or more, and it'll actually improve as they get moving. Whereas a type of joint pain from, say, wear and tear osteoarthritis usually gets worse with activity. So it can be a little difficult to delineate what type of pain is it, and is it from an autoimmune disease like rheumatoid arthritis, or is it just from normal wear and tear?
The main thing is not to ignore those symptoms, because often people think, well, I'm aging and therefore I'm a little stiff in the morning. Should they seek help?
I absolutely think so. I think it's very important for patients to be aware of their symptoms and not to discount things out of hand. Because of course it is normal for some things to change as we get older, but not all of those changes are normal. And if you're the only one who's seeing it, then you may not have a good context for, is this normal or not?
Yeah, absolutely. Great advice. And Dr. Singh, we've heard a lot about all of these new medications that really were created to treat diabetes, but they are helping with weight loss. How do they work, and are they safe? And when are they covered by insurance?
So I think we're referring to the GLP-1 agonists, and there's been a lot of talk about these medications. What GLP-1 agonists do is that they mimic a hormone, which is GLP-1. It's called a glucagon-like polypeptide, which is produced by our intestines when we eat food. So what this hormone or medication does is that it helps your pancreas release more insulin. That's how it helps lower blood sugars. It also slows down emptying from the stomach. It changes how somebody perceives hunger and satiety. So in effect, it helps lower blood sugars, makes you feel more full, appetite goes down, and that's how it helps with the weight loss. Coming to safety, I think it is very dependent on how we choose and when we choose these medications. So as long as they're chosen for the right person and they understand what the risks and the benefits are of the medication and know what side effects to look out for, seek help if they get those, I think they're very safe. Now, there are some absolute contraindications to using these medications, and those include a history of pancreatitis, can put people at a risk of pancreatic tumors, and a rare type of thyroid cancer called medullary thyroid cancer. So if anyone has that family history, and majority of the times people don't know of it, or have a history of medullary thyroid cancer, we wouldn't want to use them.
Well, that's really good information, because I think that's something everyone is talking about these days. Thank you both so much. Excellent, excellent information. Thanks for sharing your knowledge. Speaking of, we have some questions sent in from our audience. We'll get to those right after this short break. Stay tuned.
Hi, I'm Dr. Megan Grega. I'm the Lifestyle Medicine Course Director at St. Luke's University Health Network, and today I'll be sharing some healthy eating tips. You know, we have many names for chronic disease. Heart disease, diabetes, dementia, chronic kidney disease. I mean, they all sound like different things, right? But there is one common underlying mechanism at the root of the problem for most chronic disease, and that's inflammation. And by that, I mean chronic inflammation. Acute inflammation is actually helpful. For example, if you get the flu or you sprain your ankle, your immune system springs into action, and inflammatory mediators helps your body fight off the infection or repair the damage from the injury. In contrast, chronic inflammation is like this smoldering fire. It's always burning, even when there isn't a need for heat, and it can cause a lot of havoc with our health. But luckily, we have a potent anti-inflammatory weapon right at the end of our fork that we can rely on throughout the day to help calm down any excess inflammation that may be going on. And that is plants to the rescue. That's right, what we choose to eat can have a huge effect on the levels of inflammation in our body. Whole or minimally processed plant foods, especially those with bright colors and a lot of fiber, are a fantastic antidote for inflammation, while also supporting our health with all the vitamins, minerals, and nutrients that we need. So the best approach is to choose a diverse array of vegetables, fruit, whole grains, nuts and seeds, and definitely lots of beans. And make sure to spice things up with lots of herbs and spices because they are packed with anti-inflammatory compounds and they taste delicious. So what are you waiting for? Dive into some delicious whole plant foods to keep that inflammation low and you'll be good to go. Thank you for watching Healthy Eating Tips from St. Luke's.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
I would recommend the St. Luke's School of Nursing to anyone that was pursuing their degree in nursing.
When students come to St. Luke's School of Nursing, you can expect a holistic approach.
Making a program that is dynamic and diverse and evolves with time is very important to us.
We not only see the moment, but we also prepare you for the future.
When I hire the School of Nursing graduates, I know I'm getting a quality nurse.
They're here to teach you everything you need to know to care for these patients effectively.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo, and we've had an engaging and really interesting conversation about inflammation and chronic disease with experts from St. Luke's University Health Network. Now it's time to answer some questions from the members of our community. All right, so Dr. Singh, I think this is for you. I'm about 50 pounds overweight and my blood work tells me I'm on the border of getting diabetes. What lifestyle changes can I make that will help me from having to take medication down the road? And I think this is something that a lot of people are concerned about. They've gained some weight over time and now they're getting this news that they're on the track to developing type 2 diabetes. What can they do?
Making lifestyle changes is the most important factor in trying to prevent the progression to diabetes. And the first thing is recognizing this. So, I would say to the person who asked this question, it's good that you had the blood work done. You're being very proactive. Lifestyle changes that you can make would include trying to have a well-balanced, low-carbohydrate diet, trying to include physical activity and exercise into your daily routine. It's okay wherever you are right now, but just try to build up. Even 5 minutes, 10 minutes can make a difference. The recommended is about 30 minutes 5 times a week, or at least 150 minutes per week. And once you're able to get to that kind of aerobic exercises, we do recommend trying to include some resistance exercises. That does provide additional cardiovascular benefits as well as with the weight loss. Additionally, it would be important, if you're not right now, try to include more vegetables, fruits, whole grains, good sleep, keeping well hydrated, and reducing stress from all sources as much as possible.
That's amazing how much a good night's sleep can help your health, isn't it? All right, Dr. Kuparaju, this question is for you. I just turned 20 and I was diagnosed with lupus. Can yoga help manage symptoms, including inflammation? Would you recommend it and how might it help? That's an interesting question, very detailed, yoga specifically.
First of all, happy birthday. So lupus is a complex disease that can affect all sorts of different organ systems. One of the most commonly affected organ systems is the joints. And what happens is when there's inflammation in the joints, those joints tend to get stiff. And one of the biggest recommendations I make to all of my patients with inflammation in the joints is try to be as active as possible without pushing yourself too far. So I think yoga is a fantastic way to do that because it tends to be low impact while still working out your body fairly significantly and keeping your joints loose and moving. So I think that's great.
Yeah, that's good advice. I was thinking that if your joints are stiff, you're probably hesitant to have physical activity, to do different physical activities, but things like swimming or yoga might help loosen those joints right up.
And swimming in particular is a really good one, especially for some patients who may be a little bit overweight, because that helps take the gravity off of your joints while you work out, and that helps you get a lot more range of motion without getting as much pain.
So take that first step, do the thing that makes you feel better. Yeah, okay, Dr. Singh, this is for you. Does The decline in estrogen during menopause increased the risk of weight gain and inflammation. You hear this a lot. Women 45 to 55 going through menopause, worried about gaining weight or actually gaining weight. Is that what is going on?
So it definitely does have a role. When we think of estrogen, we're obviously initially thinking of just the reproductive organs and the reproductive system. But it does also have an impact on energy expenditure and metabolism. And when somebody is going through perimenopause and menopause, there is a change in that metabolism. There is a decline, and that does predispose people to a higher risk of gaining weight, prediabetes, as well as cardiovascular events. The other component is that it does have an impact on the inflammatory system and decreases inflammation. So a decline in estrogen levels does increase inflammation and increases the risk of insulin resistance.
It's good to know that that's happening, and you have to just work against it, I guess, as best you can. All right, Dr. Kuparaju, this is for you. Can the natural process of aging, as long as we're talking about aging, be the reason enough for chronic inflammation? And what can I do to naturally flush out inflammation and stay healthy as I get older? We hear a lot about inflammation. What can we do to keep our inflammation down? Are there daily practices?
Absolutely. As Dr. Singh was saying, as we get older, we do naturally tend to get a little bit more inflammation just generally. As far as is that active inflammation causing something like a new autoimmune disease, it's very unlikely. Most people who develop an autoimmune disease will do so before the age of 50. Not that it's impossible to develop it after, but the majority of patients will develop their autoimmune diseases by the age of 50. In regards to what can we do to help keep that inflammation down, a lot of it boils back down to lifestyle, which is one of the things we've kind of been hitting home this whole time. So trying to eat clean, low carb diet if you can, avoid processed foods for sure. And to be honest, I've had patients who just cut out processed food and sugar from their diet, and even though they do have an active autoimmune disease, they feel so much better. So I think one of the biggest pieces of advice I can give to patients is try to improve your diet if you have the means to do so.
That's absolutely great advice. Dr. Singh, what do you want viewers to know about the types of symptoms that should make them pick up the phone and either call their primary care physician or get a referral to your office? What are things that they might be ignoring that you don't want them to ignore?
That's a very broad question, Ashley. And if there are any symptoms that are going on for longer than a couple of days that there doesn't seem to be a good explanation for, because often symptoms that are very generalized, they could be related to a hormonal condition or an autoimmune condition, but it could be something very different, like lack of sleep or not eating the right food, not keeping well hydrated. So it's very difficult to just say, is there one system or one symptom that would prompt a referral to an endocrinologist or a rheumatologist for that matter. So if you're experiencing any symptoms that don't seem right, please reach out to your primary care physician. They are your first point of contact. And I think that's where they can decide who the best specialist to refer out to would be if they're not able to do that on their own.
Excellent. Such good advice, because it's so easy to ignore something that's just a nagging little thing in the background of our busy everyday lives. So thank you both for such great information and such good encouragement to our viewers out there. For more information on inflammation and chronic disease, as well as the services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. Thank you for tuning into this special episode. We hope tonight's program leaves you feeling informed, inspired, and most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.